We're now going to move on and demonstrate some strengthening exercises that have again been shown to benefit anterior knee pain. Strengthening exercises should, in the main part, should not replicate any of the pain that you experience. Strengthening exercises, the aim is to elicit a feeling of fatigue into the muscle, and fatigue can be experienced through either a feeling of tiredness in the area, or if you start to notice that the quality of the movement starts to become a little bit jerky or erratic, that can also indicate that fatigue is taking place. So the first exercise that we're going to demonstrate here is we're going to demonstrate a static quadricep contraction. So we have the patient laid down, comfortable position. We bend up the opposite leg that isn't going to be exercised. The instructions that we would give is to pull your toes up towards you, pull your heel away on the bottom, have a nice strong contraction coming from the quadriceps. You can observe that happening there. Hold that contraction for 5 seconds, and then as you relax, just let it slowly drift off. And we'll just repeat that again, bringing your toes up towards you, push your heel away, knee down into the bed, thigh muscle tightens, hold for 5 seconds. And relax that there. And once again, we mentioned obviously that we're doing this to the point of fatigue. A suggested starting point may be sets of 10 repetitions, going for 3 or 4 sets of those, but fatigue could set in either pre that or it may take a little bit longer. So the second exercise that we're going to do is we're going to just allow this leg to drop down as well. And this one is called inner range quadriceps. And we're going to introduce something comfortable behind the back of the knee. In fact, I'll maybe just put it behind this one. That's all right, yeah. And yeah, something comfortable behind the back of the knee, which just creates a short knee bend. And we are now going to ask the patient for a very similar command, okay, to bring your toes up towards you, push your heel away, straighten the knee. That lifts your heel up off the bed. You'll notice that the thigh doesn't move off the support. 5 seconds, and then slowly relax back down. And just going through a couple more of those. So toes come up towards you, push the heel away, thigh goes down on top of the cushion, straighten the leg, nice and slow as it comes up. Really good strong contraction for 5 seconds, and then that's important to slowly contract all the way back down. Okay, and just last one. Toes coming up towards you, heel away, really nice contraction, and slowly lowering. Once again, very similar on the repetitions. Fatigue is what we're looking to create, but a good starting point, maybe 3 or 4 sets of 10 repetitions. Okay, we're now going to come over to the edge of this bed, where we are going to demonstrate an exercise which is called a sitting short arc quadriceps. And we are getting the patient on a nice stable surface, sitting comfortably. And what we're going to do in this position here is we're going to extend the knee, bringing the toes up, bring your toes towards you. We really want to get to the point where the knee feels like it's locked out on this muscle. Again, you can see a nice strong contraction coming from the quadriceps, 5 second hold, and then just letting it slowly control, lower down. And again with that one. Foot comes up, toes coming towards you. Hold a really nice strong contraction, 5 seconds, and then slowly lower that one back down to the floor. Again, fatigue being the aim, you're working till you see these muscles start to lose the slow control movement. And a good place to start would maybe be 3 or 4 sets of 10 repetitions. Now moving on to an exercise which is the aim of which is to strengthen the lateral rotators of the hip. Another area which is proven to be particularly important when dealing with patients with anterior knee pain. So we have our patient comfortably inside lying, trying to think about keeping the spine as straight as possible, going up into the head, where the prompts we're going to give is to engage the lower tummy muscles and the bottom muscles just slightly. We've got our feet together and our knees bent at right angles, and what we're going to do is, keeping your feet together, we're going to lift the knee up, turning towards the ceiling as far as you can comfortably move. Again, just holding that position for a few seconds and then coming back down. The next muscle we're going to demonstrate working is your hip abductors. For this particular exercise, we want the patient to be lying as straight as possible. It's quite useful to have your elbow and your hand supported, just like we have here, to avoid you rocking backwards and forwards. Once again, the command is just to engage your lower tummy muscles and your bottom muscles to keep your pelvis in a nice neutral position. And then what we're going to do is we're going to try and keep the leg nice and straight as we bring it up towards the ceiling. Try not to drift it forwards or backwards, and then just holding just for a second or two, and then lowering back down. Lovely. And we'll just maybe repeat another one of those. So the leg comes up, nice controlled fashion, trying not to rotate backwards or forwards, or flex the hip or extend it, and nice and controlled back down. Once again, we're looking for those feelings of fatigue to be taking place, but 3 or 4 sets of 10 could be an ideal place to start. We're going to move on to an exercise that doesn't solely strengthen the quads, but the quads is probably the main muscle which is working here. We're also getting a little bit of activity, or we're getting quite a bit of activity in the hamstrings and your bottom muscles as well. And we're going to ask the patient to stand up essentially slowly, and then to sit back down in a controlled manner without using their hands. The prompts that we're going to give here are to try and keep the ankles, knees and hips in as much of a line as comfortable. To have your feet just slightly tucked in under you, and as you go to come and stand up is to try and think about bending from the hips and coming up, as opposed to bending from your back. So try and keep your back nice and straight. That's really good. And then again, just coming back down in exactly the opposite way. Lovely. And again, just as we come back up, so the key thing there is to try and limit the knees drifting towards the midline as much as possible, and that will usually indicate that you've got some gluteal activity going on to prevent that from happening. And just once again, bending from the hip, coming up, nice straight back, and likewise, lovely, slow and controlled on the way back down. The next exercise that we're going to be demonstrating is a lunge exercise, and we are going to ask the person to step forward onto the leg to be exercised at just a nice comfortable distance, and then to slowly lower into a lunged position. So if we can just demonstrate that. Good, and then coming back up in a nice controlled manner. Lovely. Just going to repeat that a couple of times again. The thing to look for is just to try and again just keep the lower tummy muscles engaged, so that we keep a nice straight posture in the upper body, and maybe just 1 or 2 more. And once again, that we don't allow that knee to drift across the midline too far, so try and keep the hip, the knee and the ankle in a line. A nice controlled manner, slow on the way down and nicely on the way back up. The very last command is just to try and make sure that your knee doesn't go too far over the top of your foot. We're now moving on to a stepping up exercise, where the leg that's to be exercised is placed on a step, a nice stable surface. So if we can take one of the legs onto there, and the idea is that we're now going to take the weight forward, transfer up onto the step, and use the exercising leg to control that motion as you come up, and then just to reverse it back down nice and slowly. Good. And then to come up again, and to reverse back down nice and slowly. Things to watch out for here, just to try and keep your hips as level as possible, so we're not dropping down on one side. It's generally better not to lock the knee out fully, so if we can, just to keep the leg just a little bit relaxed at the top position, and then lower back down in a reverse manner there. Good. We're now going to demonstrate a stepping down exercise. Again, you can always use a support for balance if it's required. We're now going to have the exercising leg being the one that stays up on the step, and we're going to bring the other leg off towards the surface below, nice and slowly controlled as we do that, touch down and then reversing back up. Okay, could we do that again just with a slightly less of a pause at the bottom, just so you go down and almost kind of touch and then go back up. Okay, cool. So stepping down exercise, lowering the weight down, nice and controlled, touch and then coming back up. Lovely. Again, the things to watch out for is trying to keep your pelvis as level as possible. Try to avoid the exercising knee drifting towards the midline. Again, recruiting your glute muscles to do that. And once again, the idea being that we're looking to repeat this until we've created an element of fatigue. Sets of 10, until you achieve this, would be advisable.